We started with the injectables because that's what made sense. People could see that change right away. It was going to be hard to get that buy-in from them to trust me to heal their body long-term, where that tick would take a little bit longer.
Yeah.
But now we have patients that do everything with us. We love having our patients and healing them from the inside out.
I've run weight loss clinics before, and before there were GLP-1s, which I think has really changed the game. I think guys like me on aesthetics, and guys my age, I'm 40, no one has ever talked to us about what to do or what would be beneficial to do, really. We do know about some hormones because some of us played sports and lifted weights. And what would be, you know, some things that guys would be interested in aesthetics?
Aesthetically. Yeah, I am from the KISS department, keep it simple, stupid, right? There's a couple of things you can do.
Welcome to Medicine Uncensored. I'm here today at Skin Esteem with Jen Bleser, CRNA. Jen, welcome to the show.
Hello, thank you for having me.
Absolutely. So Jen, tell me a little bit about your background.
Yeah, where to start, right? So not only a mother of 5, but I started in nursing and labor delivery up 10 years ago, went back for my anesthesia degree. And about 8 years ago, I decided, you know what? I love using the other side of my brain as well, the aesthetic side. So it was just a perfect blend, perfect marriage, my procedural brain with my aesthetic side. And I opened Skin Esteem, and here we are 8 years later in this beautiful space.
It is beautiful. Yeah. It is it's making me feel like my clinic is very sterile and boring. So tell me a little bit about some of the services that you do here.
Yeah.
And I guess really, why did you get into aesthetics?
I really got into aesthetics because I realized that people want to feel good on the outside, but I realized long-term, you know, me going through lupus and having autoimmune, I really needed to heal them from the inside as well. So that's why we have such a vast array of services here at Skin Esteem. We started with the injectables because that's what made sense. People could see that change right away. It was going to be hard to get that buy-in from them to trust me to heal their body long-term, where that tick would take a little bit longer. But now we have patients that do everything with us, from hormone replacement therapy to IV therapy, peptides, to the injectables and facials here. So we love having our patients and healing them from the inside out, whatever they need. For you, your Esteem might be, you know, testosterone. For somebody else, Esteem to them might be just getting up in the morning and feeling good. So I feel like we address every facet of Esteem for each patient.
That's amazing. So you guys do quite a lot of services, and I know we talked a little bit about this. In terms of for men's health, tell me a little bit about the different types of, you do pellets or?
We do pellets. We do have a nice subset group of men, but we are super excited to announce that we will be launching an all-male clinic downstairs for our men called Maverick. Our men love it here, but don't get me wrong, but I think there's something scary for them about taking an elevator to a space they can't see. I know men want to know their exit, you know, and entry point, but we're going to offer them everything we offer here at Skin Esteem with, you know, a little bit of a twist just for our guys as well. But we do hormone replacement therapy for them here. Yes, I would say a lot of our men do come in for their toxin injectables. Not a lot of fillers for them, but they like their lasers, especially laser hair removal for our men. Even in the beard area where they get, you know, ingrown hairs where you shave. Well, wouldn't it be nice to just not shave anymore in that area?
Absolutely.
So we do a lot of dialase hair removal for them as well.
Okay, cool. And I know that you had talked about some peptides. So one of the things that has come up recently, there's GLP-1s, there's peptides. Tell me a little bit about the different types of GLP-1s that you guys provide. There's this new one that's come out, this
retatrutide.
Retatrutide. Can you tell me about that and the differences?
Correct. Yeah. So retatrutide is a GLP-3. I'm sure you guys have heard of semaglutide, which is a generic term. Trade name for that would be Wegovy, right? Or Ozempic. And then you have tirzepatide, which is a GLP-2. Trade names for that would be Zepbound, I believe, and Mounjaro. I think that's right. And then Reta is yet to be named, right? So Reta is the latest and greatest GLP-3 that is out on the market. It has an extra glucagon receptor agonist in the gut. So we're seeing less bone mass loss and less muscle mass loss for our bodybuilders. And let's be real, like we don't want our patients to lose bone mass and muscle mass. So it's important to talk to them about how much protein they're getting on board every day and adding like that weightlifting piece to the process so that we're keeping, tension on our bones and keeping bone mass as well.
Yeah, it's super important.
Right.
I think with weight loss. I mean, I've run weight loss clinics before, and before there were GLP-1s, which I think has really changed the game. Let's talk about that business side of it a little bit, because it's tougher than people realize.
It is.
This is medicine
I had no
uncensored.
idea.
So let's, in terms of what do you see when people come in and somebody does a consult and they want to lose weight? Like, what's the typical ask? Are they typically looking to lose 10 pounds, 20 pounds? Like, what do you see?
You know what? Honestly, it runs the gamut.
Yeah.
And that's what's beautiful about, compounding of the GLPs and coming to a place like a med spa and not going to your PCP for these types of things, because, the retail GLPs are only for BMIs of 28 and above, right? Well, we know a healthy BMI is 19 to 25, but to be quite honest, I hate the BMI scale. It takes in no account, right? Like, I'm a German woman, like I have muscle mass.
Right.
So I'm never going to be a 19 BMI. So it does run the gamut. And so when we have those women come in, or men, that only want to lose 10 pounds, their PCP won't prescribe this for them because it's not on label for them. But we can microdose this for them and safely get them that weight off. And also, are they in perimenopause? Are they in andropause? Do they need some sort of hormone, additive as well to get them to their weight loss goals? So we're really dialing in and tweaking in what's the perfect regimen for you, the patient. It's no longer a blanket treatment. You're getting one-on-one care with me or the other providers at our med spa.
I'm so glad you brought up andropause. Nobody talks about that. And
I've seen it.
It's a real thing. It's a real thing. So can you tell everybody a little bit about what that is, what it means, and what you do about it?
All right, so andropause for men, typically, in the same perimenopausal region as timeframes as women, from about 45 to 55, they lose over 50% of their testosterone, total and free testosterone. So you start to see joint pain. You start to see loss of lean muscle mass, inability to maintain and build lean muscle mass. You see mood changes. I mean, some have depression, where they're just in a funk, and you talk about, midlife crises. Well, when is that happening? That's happening at 50, right? 50 years of age. Well, all the hormone changes that are happening in men and women, we can mitigate. It's just like the GLP-1s. You still have testosterone, but it's not the level that it should be at to build that lean muscle mass. And I've seen just men, the zest for life come back with when you're recovering and getting their T levels to the levels that they should be.
Well, I think nowadays people are seeing the onset of that andropause much earlier.
Right.
Just based on the foods. Lifestyle.
Stress, those cortisol levels really push down our natural intrinsic hormone balances. So we are just so stressed. We're constantly swiping, right? And working. We're always accessible. We're never off. So one negative COVID did for us, I think. It's just always being accessible. So.
Well, and also it's just the culture in America. I was over in Europe. I was in Spain. And I remember sitting at this restaurant, and it was midday. Just had lunch. And in a conversation with a buddy of mine, and all of a sudden we looked up and it was like everybody was gone. And where did they go? Well, they went to have their siesta midday.
Love that.
To go home and have a nap or have sex or whatever it was.
Absolutely.
But it's a different culture.
It is. I mean, when they go on holiday, right? I mean, it's like 3 months that they're off.
Correct.
I don't think I've taken a week-long vacation in 2 years.
It's the American lifestyle, and it's just it trashes the hormones.
It really does.
And so I think it's really important what you're doing with that.
Thank you.
I think guys like me on aesthetics, and guys my age, I'm 40, no one has ever talked to us about what to do or what would be beneficial to do, really. We do know about some hormones because some of us played sports and lifted weights, and we know a little bit about that would be useful. And I know some peptides have gotten popular nowadays.
Yep. Copper peptide for the skin. And
What would be, some things that guys would be interested in aesthetics?
Aesthetically. Yeah, I am from the KISS department, keep it simple, stupid,
Yeah.
right? There's a couple things you can do very easily. Number one, I do think some neurotoxin definitely helps soften our men, but we inject them differently where we keep them looking manly, right? We can do laser treatments for them. I already mentioned the laser hair removal,
Yeah.
but we can also do, collagen stimulating treatments, right? We don't want our men to be filled. We don't want them to be too soft, right? We want them looking masculine and studious. So when we use lasers that just stimulate collagen, we just keep like the skin elastic and buoyant without giving volume.
So does that mean it's going to reduce the wrinkles?
It'll reduce wrinkles, right?
Yeah.
But it'll also make your skin like look more supple, right?
Yeah.
We don't want you looking hard.
Right.
Another big thing for our men is sunspots, like, large melasma spots. If you're balding and you have them across the top of your head, we can do lasers, Lumecca treatments to get that skin tone more even throughout. And then lastly, at home, honestly, the easiest thing you guys can do is just use SPF. SPF every day. I don't care if it's cloudy, at least a 30 before you leave the house every day. In the summer, you want to bump that up to a 50 or 70, maybe add a zinc or something. And that's the best way that you can protect and keep your skin from aging.
That's great advice.
So easy, right?
Well, and I don't think nobody talks to us about that.
Yeah.
I never grew up with somebody like, oh, well, David, you should do this with your skin. And then nobody since has ever done that. And then I look at somebody like my wife or yourself or Alyssa, who we're going to talk to here shortly, who I'm sure you guys have routines that you do to take care of your skin.
Yeah.
And so I think it's super important. I think it's something that could really help a lot of people.
And then you know what you could do is come in and get a skin consult.
Yeah.
Just come in. We don't bite, I promise. We're easy to talk to. Just come in and get a facial, get a good, exfoliation. Ask the Estes what you should be using every day, and they'll hook you up with that.
That's great.
Okay.
Are there any particular products that you would recommend for men?
Other than sunscreen?
Yeah.
I would do maybe a tretinoin or retinol once you get to your late 30s, 40s, 50s. So that's just a pure vitamin A, and that's going to help cell proliferation faster. Our cell life is about a week long, but as we age, you get layers of dead cells just kind of sitting on top of one another. It makes your skin just look dull and just super dry. So if we can get that proliferation, we get that baby skin up to the surface faster, you'll look more alert and just rested and hydrated.
Very cool.
And that's
cool.
at night. You would do that at night. Sunscreen in the morning, tretinoin or retinol at night. KISS. Keep it simple.
I like that.
Yeah.
Okay, so I want to switch gears for a second. So you're an entrepreneur.
Yes.
Here you are. You're in this beautiful clinic, and it is beautiful. You can tell that you really, it is very spa-like and the opposite of a standard doctor's office.
Yeah.
It feels spa-like, feels relaxing.
Yeah.
You could have a glass of champagne in here.
For sure.
So how did you come up with this idea? What was the motivation? You were a CRNA.
CRNA.
I have CRNAs that work for us. So I'm familiar with that. And you went this other route.
Yes. Well, COVID, right? I mean, COVID made us very polarized in the hospital. We lost a lot of great staff, and I knew that I would soon be jaded, and I really needed to find something that I was really passionate about again. And what's interesting is my aesthetic job makes me really passionate about my anesthesia job and my anesthesia job because they marry well with each other.
Tell me about that.
Well, everything we do in aesthetics is elective. None of it has to be done. It's all a bonus, right? So it really helps your patient delineate whether this is something they really, really want to do, right? So when I go to the hospital, I have people that don't have a choice. They gotta go to sleep. They have to have the surgery. It's life-saving at times.
Yeah.
So it makes me as a provider, a safer provider, right? I'm not doing this for money or cash. I'm doing it to truly get you the results that you want out of it. And therefore, I'm not gonna blow smoke. I'm not gonna give you a treatment or push some device that I don't believe in. I mean, these reps hate me. I will not buy their device until it's in my room and I've had it and everybody's here has had it.
Yeah.
It's just not going to happen because I cannot push or peddle something that I don't believe in. So I think that's what's made us so successful here at Skin Esteem is we don't have to do it.
That's awesome.
We do it because we want to, and it's going to be the right treatment for you.
And you've tried a lot of the treatments, so you know.
I do all the treatments.
Yeah, there you go. So when I used to run a cash clinic, it was the same way. It's like, how do you get behind something if you haven't sold it yourself, if you haven't tried it yourself?
Yeah.
Because if you haven't tried it yourself, you're not sold on it, is the truth.
No. And I can't sell it.
Correct.
I can't get behind it. So I think that's why it works very well.
So tell me a little bit about, and I have a good amount of experience with this, but I want to hear your side. Tell me a little bit about cash sales and the difference between handling that versus handling somebody that is coming in trying to use their insurance. Or an insurance-based clinic.
Correct. So I'm only insurance-based at the hospital. We are not insurance-based here. We are cash-based here at the med spa. Well, number one, sometimes you get a different clientele, but we hope to make things affordable to get, all types of walks of life in here. But I would say overall, our cash-based clientele can be, demanding. They expect a lot out of their services.
I found when they're paying cash for it, they're more invested.
Okay, that's fair.
And
Absolutely.
and so because they're more invested, if they follow through with the treatments, do what they're supposed to do more than if they're not, they don't have like skin in the game.
That's a great assessment.
I always find that when they're more invested in it personally, they end up getting better results. And so I totally like the cash model.
Okay.
And
you said the insurance side is not always fun.
It's such a headache. It's such a headache and it's a racket. And the insurance companies have made it that way.
Yeah.
And I could go down a whole, spiel about that. But I think there's a lot going on right now in legislation that's trying to change some things to put money back in people's pockets to empower them to get the care that they want.
To that point, we do take HSA, right? So health savings accounts. You can do that for pain, right? For your Botox injections, even your skincare treatments can be covered by your health savings account. So your skincare line, if you're protecting your skin against cancer, health savings covers that. So we do take health savings accounts. A lot of people are surprised by that. So even our hormone membership, we cover that with the HSA.
That's great.
So it's money the patient doesn't really miss, right? It's pre-tax.
Yeah.
Helps them out a little bit. And then that way they can do their aesthetic.
They've already set it aside.
Yeah.
That's great. That's great. Is there any particular service or any new thing that you're really excited about?
The new thing that I'm really excited about to get you summer ready for your beach body is the Quantum. So the Quantum is a more invasive bipolar radio frequency wand that we can use to tighten up some maybe saggy areas all over the body.
Okay.
And it is, you go home that day, you're in a garment for about a week or two, but we can still do that right now. We can probably do these treatments until about late May, but we can get you beach and pool ready with the Quantum. You can do it anywhere really in the body. Face.
Is this like lipo or is this?
It is second to lipo. So we're not going to use a tumescent and use a lipo wand, but we are going to be able to lyse fat cells with it, and we are going to be able to tighten the skin with the radio frequency bipolar tip. So you'll get a couple inch reduction in the areas. So great for the arms, Yeah. Maybe a little bit on the booty. Maybe like the knees.
Very cool.
Tummy, and then face.
Wow. Wow.
So check it out, the Quantum.
Very cool. Well, Jen, I appreciate your time today. Thank you for doing an interview with me. Thank you for having me in your beautiful clinic.
Yeah, thank you for coming.
And everybody out there, come check them out. They're down here in Northern Kentucky in Fort Thomas. Skin Esteem. And this is Jen Bleser.
Yeah. Bye, guys.